Dr. Anthony Donallo is a colorectal surgeon who takes a patient-centered approach in his practice to not only treat a disease, but also by treating the entire person. As a colon and rectal surgeon, he educates his patients so that they feel able and also comfortable in making an informed decision in line with their own goals and values. Today, Dr. Donallo will be sharing insight into fecal incontinence, discussing what it is, who's affected, and treatment options. One in particular may be giving sufferers some really needed new hope. Fecal incontinence. It's not a topic I think a lot of people are comfortable talking about, but why is it important that they talk about it with their physician, and how common is it?
Sure. So fecal incontinence is a very distressing and embarrassing condition, but it's very prevalent. As you can imagine, it's very difficult for patients to discuss with their healthcare providers. So it is important to get the word out that it is very common. So what is fecal incontinence? Fecal incontinence is when you lose control of your bowel function. You could pass liquid stool or solid stool without wanting to do it. It's very common. It's 1 in 12 Americans suffer from fecal incontinence.
Wow.
That's more common than patients with asthma. That's more common with patients with Alzheimer's disease. So again, very distressing and embarrassing condition. Because of that, it's underreported and underdiagnosed. And it's important to get the message out that it is prevalent. People are suffering, and they need to feel comfortable and discuss it with their healthcare providers.
What can cause fecal incontinence?
Yeah, so there are several causes of fecal incontinence, which include diarrhea, constipation, damage to nerves and muscles that control bowel function. Causes of muscle damage includes a very difficult vaginal delivery. Causes to the nerves that control bowel function includes conditions that patients have, such as diabetes, multiple sclerosis, also prior radiation treatment.
Now let's talk about some of the treatments that might be able to help. First, beginning with kind of a conservative approach. What might be the first approach if someone comes to their physician and says this is an issue?
Yeah, sure. So conservative options include dietary modifications. We want to make sure patients are avoiding things that aggravate fecal incontinence, and this includes caffeine, sugar, possibly dairy. We look at any of their medications that could aggravate fecal incontinence, that can cause diarrhea, that will make it worse. We want to make sure we add a fiber supplement to bulk up their stool. We want to make sure they're drinking plenty of water, at least 64 ounces a day. If they continue to have large amounts of diarrhea, we could also add antidiarrheal medication such as Imodium or Lamodal to try to decrease the episodes of diarrhea. Other conservative options include pelvic floor physical therapy, so patients can work with a physical therapist. They can work on increasing their sensation, coordination, increasing the strength in their pelvic floor muscles to help with their fecal incontinence.
And then what would be more advanced treatment that's pretty common?
The last resort that we can offer patients from a surgical standpoint is a colostomy, where we bring up a piece of colon to their abdominal wall and they wear a bag and it collects the stool. Again, this is last resort. Millions of people live happy, healthy, high-quality lives with an ostomy, and some patients, this might be the perfect option for them to improve their quality of life.
But here at St. Alphonsus, you also have another treatment that can make a world of difference. Tell me about sacral nerve stimulation. What is that?
This is the best option we have right now for fecal incontinence. It's called sacral neuromodulation or sacral nerve stimulation. And what this is, it's a minimally invasive therapy. It was approved by the FDA for fecal incontinence as well as urinary incontinence.
Oh.
It gets its name because it stimulates the nerves, the sacral nerves that control bowel control as well as urinary control. And we place a small wire that stimulates these nerves, and this wire is attached to a small device that we place just below the patient's hip bone on their backside. It's been shown to significantly improve patients' quality of life. It's been shown to reduce the number of accidents. It's The only advanced therapy we have out there that patients can do a trial. So we place the wire, we connect it to a temporary device. They wear this device discreetly under their clothes for about 2 weeks and see if it provides the relief that they're looking for. And if it does, 2 weeks later, I place the permanent device. And I actually have the device here, and you could see it's very small. It's like the size of a silver dollar. The results are actually pretty impressive. 89% of patients will have success.
Wow. Yeah. That's huge.
Yeah. So success is defined as a reduction of accidents by 50%. 40% of patients will have full continence, full control over their bowel habits. They'll have no more accidents.
Wow.
So again, very impressive results, and it's the best treatment option we have out there right now.
That's profound, right? That's a major deal, especially when you're talking about quality of life.
Yes, it really is, and personally, it's one of my favorite procedures to do because it's technically straightforward, it's a quick procedure, it's very well tolerated, but most importantly, I get to see firsthand how transformative it is for patients and how it changes their lives.
Where can viewers go if they feel that they would benefit from this, or if they know somebody that they think would benefit from this?
Sure, yeah. So they can go to our website, stalphonsus.org, and there is information on fecal incontinence. They also can call our office and set up a clinic visit with me, and we could talk one-on-one and see if these treatment options are right for them.
Wonderful. Thank you so much. Great news.
Thank you.